We want to thank you all for joining us today. We have Dr. Andrea Huseth-Zosel and Dr. Sarah Crary talking to us about the COVID-19 pandemic effects on K-12 educators in North Dakota and Minnesota.
All right, well, I'm gonna kick us off. Maybe just a quick background. So some of you who don't know who I am, I'm Dr. Sarah Crary, and I'm an assistant professor in the School of Education. I come from having been in K-12 schools for a number of years as a teacher, as a principal, and then now I'm up here in the School of Education. Andrea, you want to give a brief?
Sure, I'm Andrea Huseth-Zosel, and I'm an associate professor in the Department of Public Health. And my interest in this particular area not only relates to public health directly, but I have an undergraduate degree as well in secondary social studies education, and my husband teaches in the school district. So I was seeing the impacts of COVID on educators firsthand.
With that, we'll go ahead and get started, and we'll have our contact information on the ending slide in case any of you have follow-up questions that you think of once we're done. Please feel free to send us those as an email too, in case we don't answer them or you don't think of them during the presentation. You can go to the next slide, Andrea. Short background or outline what we're going to do. We'll cover the background of our study, how we studied it, what we found, and kind of where we see the implications on what we can do now in regards to these impact on teachers from COVID. And I know we're all still living and breathing the pandemic, but just to give some scope, some remembrance of pre and post COVID life, this was that pandemic that hit now getting close to 2 years ago. That's had a significant impact. We can see not only on the United States, but worldwide, 5.1 million deaths globally as of November 22nd, 2021. In the United States, 772,000. And the pandemic keeps impacting us. As we go to the next slide, to give a tracking of when we kick into this study. January 2020, we first identify, as we know of, COVID in the United States. March 16th is the day that the governor shut schools down in 2020. This is shortly after when Andrea and I started talking about what is this doing to teachers, because we were experiencing it, both children, spouses, we were experiencing it. March 18th, Minnesota follows suit and also closes their schools. Everybody put that halt. 30th, Minnesota reopens distantly. April 2nd, North Dakota schools open remotely and distantly. And our first round of our data was in April. And it's worth noting, we only thought we would do the survey once. We were like everybody else. We thought we would hurry up, collect, and then analyze, see what the impact was. We had no idea we would still be in the thick of it here 2 years later. Schools finished off in April. And when we reopened the next school year of 2020, 2021, we were still in COVID. It was still a mitigating factor in how we handle schools. So just a couple examples of what schools did here. Fargo Public had a hybrid. Some students here this day, some students in this day. Assigned seating, who is sitting where, we need to know. Everybody's spread out, masks are required. West Fargo had a similar plan of which students were in, which students were learning remotely. Duluth went hybrid for all schools as well. And in our own state of North Dakota, we have anything from people started off the 2020-2021 academic year fully in person, no masks, all the way to the other scope of some hybrid learning to virtual learning. So it was all across the board in the state. And this was a very contentious issue, no matter what schools did, whether they masked or didn't mask, whether they were virtual or in person. It was a very stressful time during that, but we're talking about the last academic year for it. So our goals in this research, we wanted to know what's happening with teachers in this rapid shift. We wanted to know physically, just how are they handling this sudden teaching students like this in this virtual world, in an online platform. We wanted to also explore the impact of the mitigating efforts, this extension of online learning requirements. Like I said, we thought we were only doing this once, and then like, wait a minute, we're still going. So how are the lasting mitigation efforts impacting this online learning, impacting the teachers, the hybrid learning, the social distancing? What is that lasting impact? So to dive into the methods, Andrea will cover that part.
Yeah, so what did we end up doing for our research? So we wanted to get a flavor of the impact for North Dakota and Minnesota. So what was in our backyard in terms of, what was the impact of COVID on teachers in North Dakota and Minnesota? So we surveyed teachers teaching in schools in North Dakota and Minnesota. For school selection, we randomly selected metropolitan and non-metropolitan counties in North Dakota and Minnesota because we didn't want to just focus on urban areas because we realized that a lot of our states are rural in nature. And so we wanted to make sure that we had that even distribution between rural and urban. So from those randomly selected metro and non-metro counties, we then randomly selected 5 elementary, 1 middle, and 1 high school from each of those counties. And then teachers that identified, or individuals that identified as teachers within those institutions then were sent an email invite for our survey. The research was approved by the NDSU IRB. And as I said, teachers were emailed a survey, which included a Qualtrics link. And we conducted 3 survey waves, although as Sarah just mentioned, we were not expecting to have more than 1 wave. We were expecting just to get the impact of the first of the pandemic, which we did not realize would be lasting this long. So our first wave occurred in April of 2020 when the pandemic was really just in its infancy. And here is actually a picture so we can get a better idea of where our waves occurred in the pandemic. We see time 1 occurred in April of 2020, which is very early in the pandemic. We had 765 responses for time 1. And then time 2 happened just as we were starting to hit this huge wave over that winter of 2020, 2021, when we saw cases just start to skyrocket. And so we had 551 completed surveys from that wave of the survey. And time 3 occurred then following that huge wave of winter of 2020, 2021. And that was March and April of 2021. And from that wave, we received 334 completed surveys. So our survey tool was quite extensive because, again, we didn't realize that we would be still in the pandemic, but it was comprised of several sections. And the first section included questions related to teaching experience and responsibilities, including questions on how long the teachers had taught, their grade level taught, and subjects taught. The next section focused on technology experience and support or assistance they had received. So in terms of technology experience, what are we talking about? We wanted to know if teachers had experience with several different types of technologies prior to the pandemic to see if they'd had any experience with technology to provide them with that background as we were heading into this virtual landscape of teaching. So different technologies, like did they have experience with remote access to software applications or web conferencing technology or online collaborative spaces or online or other types of virtual technologies. For that support piece, we wanted to know if teachers had received any type of support from the school district or otherwise for specific technologies. Again, prior to the pandemic, this was kind of priming us for what type of experience or what type of education had they received related to education-related technology. And that would questions included, did they have any professional development? Had they been provided with individual consults from their IT? Had they had support for specialized teaching software and support for making courses accessible to students with disabilities? We also wanted to know if teachers had received assistance with distance and online learning during those initial weeks of the pandemic. So after the schools were closed, prior to moving online and then after moving online. So we wanted to know things like, did they collaborate with other teachers, either within or outside of their subject area or within or outside of their school district? Did they receive assistance from a library media specialist, or did they go online to seek assistance? Additionally, we asked the frequency with which they had experienced several stress-related symptoms, such as sleep issues, stomach issues, heart issues, and we asked them about other types of issues that might be causing them stress, and we wanted them to rate their level of stress with certain issues, such as balancing work and home life, students getting their assignments or not attending class, or parent issues. And then for stress and depression, we used 2 validated scales to measure those issues. So the perceived stress scale was used to measure stress experience among teachers. And respondents were asked how often they had experienced each of these issues that are listed here. Since learning was moved online due to the pandemic for time 1, and in the last month for times 2 and 3. So how often had they been upset because of something that happened unexpectedly? How often had they felt they were nervous or stressed? How often did they feel confident about their ability to handle their personal problems? So these 10 items are the scores of which are added together for a potential score range from 0 to 40, with the higher the score then indicating higher levels of perceived stress. We used the Center for Epidemiologic Studies Depression Scale to identify levels of depression among teachers, and respondents were asked how often they experienced specific issues since learning was moved online due to the pandemic for time 1, and in the last week for times 2 and 3. And this is on a scale from 0 to 3, with 0 being rarely or none of the time, and 3 being most of the time. And specific issues included the frequency with which they were bothered by things that they usually aren't bothered by, frequency with which they had trouble keeping their mind on what they were doing, and frequency with which they felt depressed, among others. And again, there are also 10 items for this scale. Scores are also added together for a potential score range from 0 to 30. And we should note that scores of 10 or more for this scale indicate an increased risk for clinical level of depression. We added additional questions to the survey as we discovered we were continuing with our data collection. So we slightly modified the surveys for times 2 and 3. Because we wanted to know about different COVID-related issues the longer the pandemic went on, such as how many times they had to change their delivery method of teaching. So how often did they have to switch from in-class to online, in-class to hybrid, hybrid to online? We wanted to know the frequency with which that was happening. If they or any of their friends or family had ever tested positive for COVID, if their school had returned to face-to-face learning, their comfort level with face-to-face teaching, and their vaccination status. All of these results, I should say, will not be discussed within this seminar, but we will be publishing these results. Additionally, we asked specific demographic questions such as their age, gender, marital status, education, race and ethnicity, household income, and presence and age of children living in the home, because we felt that this might have an impact on the level of stress that teachers were experiencing if they'd have children in the home and then also were teaching online and having to deal with work-related stress. And now we'll move into our results.
And it'll tie in with the demographic questions to begin with. So what we ended up finding is overall our pool of participants and respondents, and you can see on the slide, each time it was a similar demographics where overwhelming, they were females who were responding, most married, most with a master's degree. And this is fairly representative of the education field in that there are more women in education. Many of them do have their master's degree. So we found that we ended up being fairly reflective in our sampling. And then as we look at teaching experience, again, across the board, we have a handful of new teachers as well as quite a few with 10 or more. So these are more veteran teachers when you have 60% of them having 10 more years of teaching under their belt. A variety of grades, and about 40% had at least one elementary, one middle school, one high school grade in there. So again, the differences, and we did for our study define middle school by 6-8 as opposed to a junior high. We did do middle school in that age range or grade range, and so then elementary is K-5 with high school being 9-12. And I know across North Dakota some of those schools vary, but those are the ones how we drew the line for it. Looking at the subjects that they taught, again, pretty representative of a school makeup in that most of our teachers were from the core areas. But we did have a decent representation from the fine arts and from some of our career in tech and our encore classes, electives, depending on what the school district, how they term them, but fairly consistent. So who are our people? One of the questions we wanted to know is what kind of knowledge they came in, what kind of experience did they have for this? And I know there's a handful of educators from the field that are here. It's one thing that's important to notice is important to note, this is just what the teachers came in with. This is not a fault of the schools, but we find out they weren't really prepared for teaching on this Zoom. They didn't have that prior knowledge. They didn't have that prior experience. They didn't need it, but over half did not have prior experience with web conferencing such as Zoom. 56% had, almost 57% had some experience with working with the cloud, whether it be Google, Dropbox, what it might be, but at least 40% of our teachers who didn't have that experience. For working remotely, for working from home, only a quarter of our teachers had that experience of accessing what they needed to. What they did have is, I misrep the online, the Google one, they actually have 80% there. I was talking about just cloud-based, not as many had experience there, but for Google Classrooms, a lot of our schools use Google Classroom, or they use a different learning management system like Canvas, or Schoology is heavily used. So our school teachers knew how to use that, and then overwhelmingly are comfortable using email. In the next slide, what we find out is there was very little prior ability training on how to take a class and make it virtual, because the focus of schools was this bottom one of providing professional development around the integration of the use of technology into your training. What had been the focus of K-12 schools, many across the state, is how do I use the technology to enhance my in-person lesson, not how do I have online be my main delivery model. So 75% of our teachers didn't have that skill, and basically with what the pandemic did in the time one training is say, ready, set, go. You have a couple weeks, go. And then as we go to the next slide for, again, the time one, where do they turn to? Okay. We see from the previous one, they didn't have the experience, they didn't have the training. So where do they turn to? They turn to their colleagues, both within their content area. I'm social studies in my background. So many of them turned to other social studies teachers or any other colleagues they had in their district, as well as just turning online, Googling for help, searching for help, seeing what Twitter has out there. They're turning to social media. Only 40% were able to received assistance from a library media specialist or a different specialist. And that may be reflective of the rural population. Not all of our rural areas have an abundance of library media specialists or other specialists because of the size of their district, but 60% didn't have anybody to turn to. So they're figuring it out at the same time, and they're turning to people who are also trying to figure it out at the same time. When we look at a little bit more over the course of this, our study, again, we were able to ask a couple more times different questions. What an interesting One was, since the start of the school year, how many times have you changed your delivery mode? Have you gone from in-person to virtual to hybrid? How many times have this switched? In our time two, which would have been then 2.5 months of the school year, we had 66.8% of our teachers switching their delivery mode at least one time. So going from in-person to hybrid, or from virtual to hybrid, at 66.8. In our time three, which would be almost the entire academic year of 2020, 2021, 92.3% of our teachers changed their delivery mode at least once. 62.1 changed their delivery mode at least 3 or more times. It's a lot of shifting. So when we get to the next slide, what are we finding out? We're finding out our teachers are, a third of them were uncomfortable returning to classroom teaching. COVID had made them fearful of returning. In addition, we have teachers who, through no fault of the school district, weren't trained to teach virtually, because we teach our kids in person. Many of these teachers were changing how they were teaching, often with little notice. It might be Friday, and on Monday they're going virtual, and then they're uncomfortable. So then this leads us into, what is this doing to their stress and depression levels?
Yeah, so this is getting kind of to the meat and potatoes of what we were trying to ascertain. So again, we use the perceived stress scale to measure stress levels among teachers. And they were asked to respond to different scenarios and the frequency with which they experienced these issues, including the frequency that they'd been upset because of something that happened unexpectedly, the frequency they felt nervous and stressed, among other issues. And this is on a scale from 0 to 4, with 0 being never experiencing these issues and 4 being experiencing these issues very often. And I should note that we added these scores together for a potential range from 0 to 40, with higher scores indicating stress levels, higher stress levels, and a score of 20 or higher indicating increased levels of stress. And so we see here that at the start of the pandemic, which is time 1, we had average stress levels of 19.25 for teachers. Time 2, we spiked at 22.69. So this is really when we saw the height of stress for teachers, at least for the time periods that we were studying. And then time 3, stress levels dropped off a little bit. They were still elevated as compared to the first part of the pandemic. We should also note that, you know, we want to compare this to the general population, right? Because teachers are a special population. There have been other studies done using this specific perceived stress scale, measuring stress in the general population. And the average stress score in the general population around the same time that we were surveying our teachers was 16.8. 16.8 for an average stress score as compared to 19.25 for the stress score that we found for the teachers that we were surveying. So there was a significantly larger or higher level of stress among teachers than in the general population. We also wanted to look at levels by gender, as previous studies had shown that there are differences in stress levels for teachers by gender. And we found that female teachers are significantly more stressed than their male counterparts at all 3 time points, with stress peaking for both genders at time 2. And again, that was October of 2020. And again, if you notice, stress levels, although they did decline in time 3, they were still elevated beyond what we saw in time 1, which was the start of the pandemic. So they've been experiencing extended levels of stress. And this was just for the 3 time points that we were studying. We also asked respondents about specific stress-related symptoms that they were experiencing at these 3 time points. And feeling more tired was the most frequently experienced symptom, followed by teeth grinding, stomach issues, and chest pain or rapid heartbeat. And frequency of experiencing these symptoms was highest at time 2, again in October of 2020, and lowest for the onset of the pandemic at time 1, which was April of 2020. So we see that teachers not only were experiencing stress, they were potentially experiencing these physiological manifestations of stress as well for extended periods of time. Again, respondents were asked to indicate stress levels with specific issues, and we wanted to know how stressed they were about these issues. So were they not at all stressed? Were they extremely stressed? And respondents were more likely to be stressed about balancing work and home, which I think is understandable, especially during the time of the pandemic, when potentially they were working from home. They were teaching from their homes. And then in the fall as well, they were potentially working from their school with modified hybrid, with online versions of that. So how did they balance that connection between I'm at home and I'm working, or I'm at school and I also have to deal with my own children? They were also stressed about students getting their assignments submitted and students not attending classes as needed. These were the issues with which teachers were most stressed about. And again, stress levels for all of these issues were highest at time 2, which was October of 2020. So let's look at depression next. And again, we use the Center for Epidemiologic Studies Depression Scale, which is a validated scale used to measure depression. And respondents were asked to indicate the frequency with which they experienced 10 specific issues on a scale from 0 to 3, with 0 being rarely or none of the time and 3 being most or all of the time. And some of the issues that they were asked to indicate the frequency that they experienced these were, I was bothered by things that usually don't bother me. I had trouble keeping my mind on what I was doing. I felt depressed, among other topics. And again, the scores are added together to form a composite score, with scores of 10 or more indicating an increased risk for clinical levels of depression. In April of 2020, the mean depression score was 12.58, with the highest scores or highest levels of depression being seen at time 2, with an average score of 14.64. And then depression scores dropped in spring of 2021 in time 3 down to 12.41. Again, we should note that other research was done during the early days of the pandemic in 2020, and this research found an average depression score using the same scale that we used of 10.49 for the general US population. So 10.49 for the general US population and 12.58 for the teacher population that we were surveying. So these depression scores for teachers from our study were significantly higher than the scores for the average US population. And again, we wanted to know if there were differences by gender for depression, as previous studies had indicated that there were differences for teachers by gender and depression. And we found that female teachers, again, were significantly more depressed than their male counterparts at all 3 time points, with depression peaking for both genders at time 2. And that was October of 2020. We also asked in time 3, and it was only in time 3, which was April of 2021, which is just this past spring, how likely they would be to return to teaching in the fall, which would have been this fall. And 8.3% of teachers stated that it would be unlikely or extremely unlikely that they would return to teaching in the fall, with 12.4% being neutral or unsure about their decision. So when we look at stress and depression scores by likelihood of returning to teaching, we see that in general, those teachers who were more stressed and depressed were less likely to indicate that they would be returning to teaching in the fall. So the stress and depression related to COVID and these changes in teaching methodology and the impact of their career on their mental health really played into their decisions about whether or not to return to teaching. So while we don't have the hard numbers on teachers who decided not to return to the classroom, when you look at the headlines from this past fall, and these are just a few of the headlines as it relates to teacher levels, you can see that there's a pattern of nationwide teaching shortages. So we see this research really playing out in the headlines, real time in school districts, with teachers deciding not to return to the classroom, potentially due to the mental health issues residually from COVID. And we will now move on to the implications of this study.
So what does this all mean? And this gets at why we wanted to do the the research. My big interest being I came from being in the field. We know that before COVID, teaching had a high burnout. You can find it in the research. Teaching has one of the highest burnout rates because of all the demands. The demands of you don't really feel fully ready until you're in your classroom. It's one thing I can speak to and only from my own experience is you don't know what you don't know until you're in your class. And it takes you several to figure it out. Teachers before COVID were leaving because of uncertainty, lack of support on what they're supposed to teach, lack of support for the emotional drain sometimes of working with students and trying to be there and support them. And so where little kiddos come in with needing some real love and support. And so pre-COVID, 50% of teachers were leaving in the first 5 years. What are we finding out, especially right away with this kick into COVID, is it exacerbated these issues. We see that the mental health implications for teachers is increased, I should say, that this rapid shift, teachers were at home, they were isolated. They again didn't have that same support network. They were hopping on to Zoom to teach and then hopping off. There are a lot of uncertainty on what is the modality in which I'm going to teach next week. Is it changing? What is going on with COVID? And again, we saw that teachers didn't feel pre-COVID, teachers didn't always feel trained, ready to teach. During COVID, they weren't trained and skilled and ready to go. And again, this isn't a fault of the school districts. None of us got into teaching K-12 to teach online, so we weren't prepared to teach online. But that rapid shift made it hard for teachers. And then with that came an increasing workload of what to do. We know that even after the first time of collecting the data into the latter ones, that uncertainty is still there. And while we've already collected 3 rounds of data, we might collect next April, but we know the uncertainty is still there when you look at even regionally here. There's some uncertainty what the mitigation is going to be. Where is that level of which schools go back to hybrid, especially with the continual mutations of this virus, and what does that mean? And I by no means pretend to have deep understanding of any of that, but we know that we keep having mutations emerge that adds that uncertainty for education. And then through all of this, there's been a learning gap for students. What teachers have wanted to accomplish and what they've accomplished aren't the same thing. What's that rule? How do you do the makeup? So realistically, whether we decide to collect another round of data in April 2022 for 1 year out or not, the unclear expectations and work overload as a result of this are present, and they're weighing on teachers. And so then that takes us to our next slide of our implications. If we aren't going to stop and do something for our teachers, we're going to have burnout. So as Andrea pointed out numerous times, time 1 data from this pandemic, teachers were above that level of a concern for being clinically diagnosed with stress or depression. They're above the average for the rest of the world in where their levels are. Now, even as we've come down to time 3, and if you remember back to the initial graph, our numbers were going down, things were looking better. Teachers were still operating at a high level of stress and depression, higher than they were when the pandemic first started. So our teachers have been operating at this high level of stress for 1 year. That is going to lead to these negative physical health outcomes of fatigue, headaches. We're finding that in the reports from the teachers. They're experiencing that, just this constant tiredness. When it comes to their job, it's going to have impact on how satisfied they feel with their job. They're not going to report that same level of a great lesson from the hybrid time because they didn't know what they didn't know. In that feeling tired, feeling burnt out, their effectiveness of teaching has taken a toll in being stressed, in not knowing what they don't know, which means the relationships with students has been impacted. And in education, in K-12 education, the first and foremost thing you have to have is a relationship with your students. If you want academic outcome, you have to have that connection with your students. And that means being there for teaching. That means being present. And I'm talking like mentally present, not tired. That means being armed with the necessary tools that you need to be an effective teacher. So when we go into what do we need to do? What do we recommend? What are we finding? Teachers need some resources and some coping skills. Our region in particular has had a heightened awareness to providing mental health support to our students because they've rightfully so needed it. We've seen this, and there's been that outcry of we need to provide more support. That needs to go to our teachers as well, because if our teachers aren't there to support, our students aren't getting that same kind of support and relationship they need. So teaching our teachers coping skills, giving them ways to make that connection with others, to find somebody who, if they're excelling at teaching in a hybrid mode, they're excelling at closing a learning gap, sharing that out, providing that information with everybody, providing access for our teachers to mental health support might be needed because some of them, again, operating for a year, may need that door open to go and talk and receive supports that our school administrators can't do. They're busy doing too many other things. It's not, so let's give them the right people for that support. Mindfulness training. How do our teachers disconnect? How do they take that break? How do they step back? I know in working with some of the teachers I have this year, every prep period is they're off subbing in somebody else's class because they don't have subs. So how do we give teachers those breaks, knowing we need to have all our periods covered and we need to teach our kiddos, but how do I give them a 1 minute break? And what I would say for our administrators, being conscious of the workload. What is it you're asking the teachers to do? Being clear on what you're asking them to do so they are on the same page as you and know what it is they need to accomplish. And what are maybe some of those things that if they can get to it, great, but if they can, it's okay. Kind of scaling back, taking a step back and maybe certain initiatives. And just being aware of what we're asking them when they're covering for different classes. Is there a way, are there other options? Are there other ways to be creative in it? This is a short snippet of just where we've even started diving in and looking at everything as well as the timing we had here. I know our next steps beyond this data is to keep looking at some of those other questions Andrea pointed out at the beginning that we didn't share, as well as analyze the data we collected from higher ed faculty on what they experienced during these same points. So with that, I'm going to wrap up and see, we have a few minutes left if there's any questions.
All right. Does anybody have any questions? This was a great presentation. I want to thank you both. If not, we do have one that I can start with. This is from Dr. Meyer. With the increasing demands on teachers outside of COVID, such as new legislative policies and demands on reporting requirements, what would you suggest on a policy and administrative level can be done to reduce stress?
With the increased requirements for reporting, is that the bill that was mentioned?
It just says so, such as new legislative policies and demands on reporting requirements.
Oh, okay, because the reporting requirement, I was just thinking it would be a different bill there. I'm trying to remember which law, and this talk about which policy it is.
Do you want me to try to clarify my question?
Yes.
Okay. Hi, thank you both very much. That was wonderful. So I also wear a school board hat, so very interested in a lot of this as well. There's an increase in a lot of demands on teachers and administrators. Every legislative session, it seems like there's more and more demands that are coming through. Some things such as there was the Boy Scout policy that came in. Now we have to make sure we have Boy Scouts have access to the schools at any time. We have to make sure that mental health needs of kids are monitored at all times, which is important, but it's increasing demands and things to watch for that the teachers are being required to do. So with all of those other things happening, in addition to COVID uncertainties, what can we do at that policy or administrative level to reduce this stress level? And I know you might not be as experienced in that area, but I know you have practical experience. So if you can address any of that, I know we have some legislators or people that work in policy on, it would be really interesting, I think, to hear your perspective. Thank you.
For me, what I talk to my students about is, what is our goal in education? What are we doing? What is your role as a teacher? What do we want our students to learn when they're done? And again, I come from social studies, so I'm fully aware there's a ton of stuff I teach that I think is great and interesting and everybody should be passionate about, but they aren't. What is it I actually want them to know from my class? For me, I always want them to know how to think and how to justify their thoughts, how to defend their thoughts. I can do that with a lot of different pieces of information and not get so overwhelmed with teaching as I used to in an AP class from Aztec to Clinton being elected. It's what is our goal and what can we take? What's that extra noise we think we have to do? We really don't. What are some of these extra meetings we don't need to do? And it's looking at what is our goal, because we're not a factory of knowledge school anymore. That's not our era. What is it we want them to know, and how can we do that? How can we pool our efforts and resources together and use each other's thoughts, and not always get overwhelmed by it? But so hopefully that answers a little bit of your question. I'm picking on myself a little bit.
All right, another one we have in the chat is from Taylor Toso. They want to thank you for the insightful presentation. What significant differences, if any, do you anticipate to find between the results of K-12 versus higher ed?
I don't know what we'll find. I think we're curious to see. I came out of a program that already was using hybrid teaching. We were already having the blended.
I did as well. So it will be interesting to see what the difference, and quite honestly, we haven't even delved into that data yet. We haven't even had a chance to unpack it. So there's the potential that we might not see stress and depression levels as high as they were for K-12, because some of these instructors were prepared to teach or had been teaching in a hybrid model or in an online class. But when we find out, we will let you know, because we're so curious. We are very curious to see what these differences are.
And Dr. Carson, do you have a question? I see your hand up.
Great presentation. Thank you. Couple quick questions. I might have missed it at the beginning, but could you tell me what your overall denominator was and what your response rate was? I think you said you had a few hundred responses, but out of how many?
The response rate was very low. Quite honestly, because some of the emails that we sent out were to listservs. We don't have a definite number for that, but it is in the 5 to 10%. Fingers crossed, 5 to 10%.
Any chance you got even a small sample from the non-responders to kind of know if you had a representative sample of teachers, or maybe these are the more stressed or more worried or the more concerned teachers that responded?
We can say that we did get emails from teachers that said, I am too stressed to even fill out this survey. So please stop asking me to complete this survey. So yes, there's the possibility that there's a difference between those who didn't respond and those who did. There's a potential that those who didn't respond are even more stressed than those who did respond, but vice versa as well. So we don't really have that.
And then I was wondering, you had comparative rates on the stress scale and depression scale to the general population around the same times with COVID. Just wondering if you have had any sort of baseline rates from or scores in either stress or depression scales pre-COVID for teachers. I mean, you said teachers are kind of stressed in general. Was this a big jump from their normal level of stress, or do you have any sense of like how different this might have been to what they sort of experienced at baseline?
We don't. There have been studies done on stress and depression rates among teachers, obviously pre-COVID. There were very few, and I don't think we found one that used the scales that we were specifically using. And so while we can just conjecture that stress levels did increase, we do not have a strong understanding of the extent that they increased from pre-COVID to during COVID.
Any other questions or comments before we wrap up today's seminar?
I think we're 1 minute beyond our scheduled time. So I want to thank everybody for coming, and hopefully everybody here obviously is concerned about the teachers in their districts, and to show them some love and support, and to really be supportive of those who are working in the classroom.